consists of the brain box, where the brain is, a place where the eyes are, a place where the nose is, and a mechanism of the upper jaw and lower jaw, which is for eating, chewing, and gulping or deglutition, so which we call as the mouth. And finally, we have a space for the ear. The brain box consists of a frontal bone, two parietal bones, an occipital bone, a temporal bone, and the sphenoid. We'll show you these in a minute. So this is the frontal. These are the two parietal bones, this one and this one. Then this bone here is the parietal, but this one is the temporal, this one. This bone here is the sphenoid. It is a wing of the sphenoid, which has got an inferior surface and a superior surface. And finally, this one is the occipital. So occipital, two parietals, temporal, sphenoid, frontal. So this is what the brain box consists of. Now, the face consists of two orbits. So this is the one orbit and the second orbit, which contains the eye. And this is the bone, which consists of the nasal bones, these ones, a maxilla, which forms the boundary of the nose. This maxilla forms the nose, the orbit or the eye, and the upper surface of the mouth, and also the part of the cheek. There is a triangular bone which is called as zygomatic. So besides the frontal, parietal, temporal, occipital, sphenoid, in the face you have additionally the nasal bones, the maxilla, the zygomatic, and after that you have the mandible. This is the mandible. And this mandible moves on the temporomandibular joint, opening and closing and moving from side to side, so that food is grinded between the teeth. So this is your introduction to the skull. Now this skull is mounted on the cervical spine. Now the cervical spine connects it to the chest and allows the movement of the skull. So here is the skull. And here is the mandible. and this whole skull is mounted on a cervical spine, cervical vertebra, 7 of them connected to the thoracic vertebra. Now this skull can flex, and therefore there are flexors of the cervical spine. It can extend. So these will be the flexors and these will be the extensors. Then there are lateral flexors. That means it can go from on the right side flexors and left side flexors, and then it can rotate. In saying no, it can right rotate or left rotate. So one of the functions of the cervical spine is providing movement to the skull. The other thing that it does is that after the food is deglutited from the mouth, it passes through the food canal, or what is called as the esophagus. The next thing that happens is that air coming from the nose crosses onto the trachea, and here you have the trachea. So there is a trachea esophagus in the neck. Besides this, the major vessels of the head and neck, the carotid artery and the jugular vein, they rise from the thoracic inlet and go and supply the head and neck. Besides that, the brachial plexus passes into the upper limb, supplying the nerve supply to the upper limb. The cranial nerves supply the head and neck. Besides this brachial plexus, the subclavian artery and vein supplies the upper limb. So the neck provides movement to the skull. It provides passage to food and air. It provides passage to the blood supply of the head and neck and the upper limb. And it also provides passage to the nerve supply of the head and neck and the upper limb. Besides this, it contains the thyroid gland. So this is about, in brief, about the head and neck.